looking at how our workflow has evolved over time, the PERT workflow before we introduced Aidoc was as follows. And this is probably pretty similar to most of the world beforehand in terms of places that had a PERT team in place. As patient was scanned and had a PE and they got a CT pulmonary angiogram, the diagnostic radiologist would have to get to that scan on their work list. They would read the study. They would make the finding. They would alert the primary team about that finding. The primary team would then have to consult pulmonology. Pulmonology and critical care are in our PERT team, the gatekeepers, the kind of quarterbacks of our team. So they receive all the consults. They would then assess the patient, engage IR, cardiology, or CT surgery as necessary. We would then go assess the patient, discuss it as a multidisciplinary team, and decide on what the appropriate intervention was for that patient. So there are two real gatekeepers in this process, right? There's the diagnostic radiologist when they get to the study and when they read the study and make the finding, and then there's also the primary team. And so, you know, their workflow, their timelines, their awareness of the PERT team, of all the interventions, of the value that we bring, all those things may or may not have led to that patient coming in contact with our PERT and getting what we think are best practice interventions. And that led to a lot of delays in consultation and treatment. Our PERT workflow after introducing AI is very different now. Okay, so that same patient gets scanned, and immediately, step 2, if you look over here, 3 things happen all at once. The AI runs a PE algorithm and alerts the diagnostic radiologist about the PE. It also identifies whether there are the trigger criteria present to alert us as the PERT team. So that would include RV-LV ratio being greater than 0.9. And it'll notify us if those criteria are in place through the app and present us with the relevant clinical data. So we can then go and immediately start looking at the case and assess whether there's potentially a benefit that we can bring to the care of this patient. We can then actually reach out to the primary team and say, hey, there's a patient on your list that has this thing going on, and we think there's potentially a benefit that we can bring through this therapy. And our multi-specialty team, we're all aware of the patient right up front. We can assess the patient, we can discuss in real time, and we can decide on the intervention. A much more efficient and accelerated process. In parallel to that, the diagnostic radiologist, who's now been notified as soon as the scan gets done, can read the study in a quick fashion, confirm the finding, and also be in discussion with those of us who are assigned to the PERT team.